and this is my presentation about male pattern baldness. What is it? Androgenetic alopecia, more commonly known as male pattern baldness, is a disorder caused by one's predisposed genes that affects both men and women, despite what its common name suggests. And then this is an image just showing the way that the disorder presents itself in females and in males. And you can see that here in females, the hair thins at the crown of the head. In males, it's like a receding hairline, which progresses into hair loss at the crown of their head and then total baldness. And androgenetic alopecia affects the growth of new hair shafts by causing hair follicles to become increasingly thinner and shorter. These thin and short hair follicles will eventually not be able to penetrate the epidermis, resulting in baldness. Causes: the name androgenetic alopecia that means that this disorder affects the genes that deal with androgens, which are a type of male sex hormone. And then the most common androgen is testosterone, and although it's a male sex hormone, it's also found in women, and we'll go more into that later. This disorder occurs only after one has gone through puberty, which is when the body begins producing a lot of sex hormones, and in this case, more testosterone. And then this is an image showing androgenetic alopecia in a male, where you can see the hair is thinning at the crown of the hairline. Right, and then again, it's a disorder caused by a genetic predisposition. So if one's father experienced balding, then their sons are at a 5 to 6 times higher relative risk of developing this disorder. And then some more information about that is when activated androgen receptors shorten the anagen phase of the hair growth cycle, those with the genes that cause an overproduction of androgens experience an excessive amount of androgen receptor activation. And then whenever androgen receptors are overactivated, the hair follicles, you can see that there's a diagram, the hair follicles become thinner and weaker, and eventually they will be able to penetrate the epidermis, and then you just have no hair. Symptoms and prognosis: androgenetic alopecia presents itself differently in males and females. In males, this disorder presents itself by causing thinning of the hair at the front of the scalp, which is like a receding hairline, and then progresses to the hair at the top of the head. And then in females, the disorder presents itself by the hair at the crown of the scalp thinning. And although there are treatments to help manage hair loss caused by the disorder, it's normally permanent, and there's no cure or way to tell how far the effects of the disorder will last. Some treatments for male pattern hair loss include drugs such as topical minoxidil, which is the most common form of treatment for hair loss in men, or androgenetic alopecia causing hair loss in men. And the results aren't permanent, but the drug works by blocking potassium channels and widening blood vessels. And then in turn, these widened blood vessels hypothetically allow more nutrients to reach hair follicles and stimulate hair growth. And another treatment is hair transplants, which are more costly and are permanent for hair loss, which in a hair transplant, unaffected hair follicles are removed from one part of the head and transferred to another part. And then this is a semi-graphic image of a hair transplant, and here you can see like the hair follicles are implanted towards the hairline, which is likely where this person experienced hair loss. And these are probably hair follicles from more towards like the back of their head. And then treatment for female pattern hair loss includes oral anti-androgens, which are drugs that inhibit androgen hormone production. And since women also have testosterone, sometimes they can produce too much of it if their genes cause that. And then if they take anti-androgens, then they would produce less testosterone and would likely get rid of their androgenetic alopecia. And then some examples of FDA-approved anti-androgens are spironolactone and cyproterone acetate. And this is an image showing female pattern hair loss. So you can see here the hair is thinning, and then here they have likely taken an anti-androgen and their hair is thicker. And then some more information about this disorder is that it's caused by one's genes, so there are no risks or complications associated with it. And likewise, it's not contagious. And aside from taking drugs to keep androgen hormones at normal levels, there's nothing one can do to prevent getting this disorder if they already have the genes that cause it. And then if your parent or somebody you know is balding, it may be due to undiagnosed androgenetic alopecia. And that might help. Like if you know about that, then you can maybe get diagnosed early and treat the elevated androgen levels that cause the disorder. And then information from this video is from penmedicine.org, the National Library of Medicine Center for Biotechnology Information, and goodrx.com, which is like a pharmacy website that I got most of it from. And thank you.